Hello, my name is Phil Payne. I'm the Director of Career Services here at Beal University, and I'm here to welcome you to this alumni talk where we're going to be discussing the CADC. So let me go ahead and introduce our Program Director for Addiction Counseling, Stephanie.
Hi everyone, I'm Stephanie Morgan, Program Director for Addiction Counseling and Mental Health, and we are so excited, I can say that about 100 more times, to have Alisha Goss here, who is currently practicing in the field and also a student at Beal in our master's program, and really just has been through all of this, so has a great deal of knowledge to share with you and to hopefully motivate you, because we really want you all to succeed post Beal and see how many opportunities are available to you. So we're really excited for this, and Alisha, thank you so much for being here today and looking forward to hearing from you.
Thank you, Stephanie. I appreciate that. Okay. Now can they see me? Okay, great. Hi everybody, my name is Alisha Goss. As Stephanie said, or Dr. Morgan said, I am a graduate with my bachelor's degree in addiction counseling from Beal University, and I'm currently enrolled in the Master's in Clinical Mental Health Counseling. I am also the program director of the Wellspring Infinity House, which is a residential substance use disorder treatment program for pregnant women and mothers in recovery. So we're going to just go over some tips today about how to get your CADC, what steps you need to take, some studying tips, things like that, and sorry about that, and a few other things like what you do if you have a criminal background check, things like that, the questions I wish I had answered for me when I was entering the field myself. I'm currently a licensed alcohol and drug counselor and a certified clinical supervisor, and also a hiring supervisor for CADCs. So let's get into it. What's on our agenda is A, how to apply for your CADC exam, because that's the first thing you're going to need to know. Some study tips and tricks to pass your exam. How to apply for licensure after passing your exam, because it's kind of a step-tiered process. Additional steps to take if you have a criminal background, and then some tips on interviewing for an addiction counseling position, and then we'll do a Q&A, which I don't know who's overseeing the Facebook piece, but if any questions come up on that, just let me know and I can answer them for you guys. So we'll get right into it. So I just want to put this out there that I do understand that Beal does have students in different states than Maine. And licensing laws do vary by state. So it really, a lot of this is based in Maine, and I would encourage anybody who is not in Maine to consider researching what the actual requirements are to get your credentialing in the state you're in. And if there's somebody that needs help doing that, I'm always willing to help look that information up for you with your licensing board. So these are just the requirements, the basic requirements that you have to have in order to sit for your CADC, which is Certified Alcohol and Drug Counselor examination. So you have to be at least 18 years of age. You need at least 30 college credit hours in addiction counseling, behavioral sciences, or like a related field, so human services, things like that. Your proof of education, which would be your transcript, which you do get from the school when you graduate, and you need a valid ID or driver's license, and then the fee does cost $175, the exam costs $175 fee in Maine, and that's straight from the State of Maine Professional Financial Regulation Licensing Board. So that's your first steps, that you need these things. You can't apply to even take the exam if you don't have, say, a driver's license or your transcript or the money to pay for the exam or things like that. So keep that in mind as you're going forward, and some things you can kind of check off on your list of things you need to get before you apply. So this is just a broad explanation of what you can expect on the exam. It's 150 questions. They are multiple choice questions. You're given 3 hours to take the exam, which is actually a generous amount of time. And it's a proxied exam, which means that either you're doing it in a location that people are monitoring you, or there is an option sometimes to proxy online. I personally don't recommend that unless it's your only option, just in case you lose like internet connection or something like that, and they're not gonna reimburse you for the money that you paid. And so it's a closely monitored process. You can't bring things in with you, that you can't have your cell phone, essentially. The only thing you can use in there is scrap paper that they provide to you, and you can't take it out with you when you leave, and the writing utensil that they provide for you. So that's just good stuff to know. So this is a little screen grab of what it looks like on the main professional licensing page where you want to click to actually register for your examination. I will say that they have made it a lot more streamlined now. It used to be that you would have to go to the professional licensing page, and then you'd have to go over to the IC&RC, which is the credentialing page, and now they've put all the IC&RC stuff right on the main professional licensing page. So it's all right there. If you want to find this without taking a picture of what this link is up top, you can just Google Maine Professional Licensing Addiction Counseling, and it'll bring you right to the professional licensing page. But that's the section you want to look for under examination and the ADC. And then you just hit the old register, and it'll walk you through the process. It will redirect you over to the IC&RC to go through that process and register. The IC&RC website has recommended study material, which currently is this book that is on the screen. It's a little blurry, but if you click on the study materials section on the IC&RC website, it will bring you to this. And I found out, luckily, from one of our attendants that I've been communicating with, that the way you get to the book is to click on the book, and it will bring you to the information to actually order the book. This is not a book that the IC&RC has made, just to be clear, because it's going to say above it Florida something something or other. The IC&RC is an international thing, so this is the book that they're currently recommending as good study guide for your CADC. And it's actually changed since I took mine, so it's probably updated with some newer laws, and as Code of Ethics had changed like a couple years ago, so that's probably why. Other things you really want to consider studying before you sit for your exam. Number one, 12 core functions of addiction counseling. Those are the bones and the basics. You want to study know what those functions are. Those are things like screening, assessment, counseling, group, things like that. Case management, there's 12 of them. They're very easy to look up, and there's different things under each of those functions. Those will be on the exam, and when I go further into this slideshow, you'll see how that kind of plays out and how the exam is weighted. You want to look at the NADAC Code of Ethics, because that is the code of ethics that addiction counselors utilize. And you don't need to read it, front to back, but you should really get a good feel for kind of what our code of ethics says about certain things. There are going to be a significant section of it does cover like ethical pieces. So I would definitely look at the code of ethics so you know what the answer is in accordance with our code of ethics, but you also want to consider the laws and such as well. Diagnostic criteria, I can't speak, sorry, it's been a long day. Criteria for substance use disorder. So you want to know, the good thing about diagnosing substance use disorder as opposed to like a mental health diagnosis is the criteria are pretty cut and dry for each substance. So if you can memorize those criteria and how many is mild, how many is moderate, how many is severe, you're going to want to know that, because they're going to give you maybe some case studies, and it'll be like a little sample paragraph, and it'll say like John is a 34-year-old man and he reports this, this, and this, and they might ask you to give him a diagnosis based off that case study. I know there's a couple at the bottom usually, so if you don't know the criteria and what actually constitutes a diagnosis for substance use disorder and what doesn't, that's going to be an issue. Hopefully these are things that you're learning, but it is good to get kind of brushed up on that, because somebody might say, John drinks a bottle of vodka every day, so John must have an alcohol use disorder severe. That's not true. If it's not impacting his daily functioning, if he's not having withdrawal, if he's not meeting those criteria, John might not have an alcohol use disorder, though I doubt that would be likely with alcohol and how addictive it is and the physical withdrawal. But look at the local and federal laws governing addiction counseling. You're going to want to know that. It's different for every state locally, and federally there's some laws as well, like 42 CFR Part 2, which is the confidentiality law that we work with in addiction counseling, specific for people with substance use disorder. It's very strict. It's even more strict than HIPAA. So you want to know what falls under those laws, and definitely evidence-based practices and theory, especially when you're thinking of like cognitive behavioral therapy, motivational interviewing, but even understand the bare bones of some other theories, because they're gonna want to know that you know maybe what Gestalt theory is, even though that's not something we're going to be using. It's something we learn, and they do ask about it, just like they ask about pharmacological interventions or medications for depression. So knowing what an SSRI is could be helpful and things like that as well. So these are just things that I know from taking my own testing, were things I needed to know when I sat for my exam. Number one, also, don't stress yourself out. This CADC examination, it's actually, if you've gone to school and you've done your work, you'll probably pass it. I know people that have never gone to school for addiction counseling that have passed it with a great score from studying alone, because there's different avenues in Maine to get it. So don't stress yourself out. The information's in there. Just know that brush up on these before you take the examination. That's just my recommendation. So I wanted to put the domains that this is actually the domains that are covered in the examination. So this is what you can expect to see on your exam. 25% of your score is going to come from domain 1, which is scientific principles of substance use and co-occurring disorders. So, I mean, that's the principles, the scientific, evidence-based practices, principles, well, that's down there, but just understanding the science of how addiction essentially impacts the brain, the body, things like that. And also, you're going to want to know about co-occurring disorders. We are not expected to know everything about every mental health diagnosis, but we do take a co-occurring class, so understand that they're going to want to know that you know about co-occurring, because we rarely see somebody with substance use disorder that doesn't have a co-occurring disorder. Domain 2 is the evidence-based screening and assessment. Right there, boom, boom. Two of the 12 core functions are right in that sentence. So you're going to want to know those. What type of screening tools are used, the DAST, the MAST, things like that. Domain 3, evidence-based treatment, counseling and referral. So right there, we've got counseling and referral. Those are 2 more of the 12 core functions. They're telling you right in the domains, you need to know the 12 core functions. In evidence-based treatment, in any counseling field you're in, you need to know evidence-based treatment. You need to know how to understand what is evidence-based treatment, how to implement evidence-based treatment. It's the baseline of everything we do and how we can prove that what we're doing is something that's been vetted and that works. And then this last dimension 4, and that is actually 30%, where the one above that's only 20%. The domain 4 is professional, ethical, and legal responsibilities, and that's 25%. So you definitely want to know the laws and the code of ethics, which NADAC updated, I think, in 2021, January 2021 maybe. I don't know, it feels like it was yesterday, but it wasn't. And you can find that right online. Google NADAC, NAADAC, Code of Ethics. It'll come right up, and it covers each section. So I would definitely review that. Because what happens is you go on the site and they say, read all these tips from SAMHSA, read this, read that, and there's no way you're going to read 20 books before your CADC examination, nor should you. You're going to end up filling your brain with too much information when you've been spending time in class learning these things, and you can really focus on the meat and potatoes of things and get through your examination. And then a lot of learning you do after you graduate and pass your CADC is in the field with supervisors overseeing you and things like that. So don't worry about not knowing everything when you go into the field. If you don't know the answer to the question in the exam, and this was the best advice I got before I took the exam, bookmark the question. It gives you an option to bookmark it. And then you can go back to it. A lot of the time, what will happen is you'll get a question, you don't know the answer, you'll get further down in the exam, and a question further down might actually answer the question that you have bookmarked up top, or give you an idea about what the answer may be. So bookmark it, don't stay hung up on it, don't rack your brain and try to figure it out. Keep it moving, bookmark it, come back to it, and trust your gut. I am guilty of doing this myself, you guys, so guilty of this, and it ruins me every time. Try not to change your answers. If in your gut you feel like this is the answer, I will tell you right now, every time I've changed an answer on a test, I've gotten it wrong. So you know these things, they're inside of you. If you don't know them, bookmark it, and then at the end of the test, it gives you an option to click bookmarked questions. It pops up your bookmarked questions, and by then you might actually have remembered the answer or things like that. So it is helpful to, but trust your gut. It's okay to trust yourself. You've been learning these principles and concepts, so trust yourself. So then after you pass your exam, when you sit for your exam, right then and there, you're going to get a piece of paper that's printed out, okay, that tells you did you pass or not. It's like the 1 second of doom when that printer is printing. It makes me panic every time, every exam I've sat for. So you'll get a paper, it's like your preemptive score, and then they have to review it and ensure that, yes, this is your actual score. This test is weighted from 200 to 800 is the points. It's not like a 1 to 100 scale of how it's graded. It doesn't work like that. I think you just need to have more than 500 to pass. So it's really, you can get quite a bit wrong and still pass this exam, but understand some sections are weighted more heavily than others, and also be aware there are questions in the exam that are throwaway questions. Not throwaway questions, but they're test questions that they're testing out on you, essentially. And if too many people get them right, they won't put them in future exams, and if too many people get them wrong, they won't put them in future exams. However, you do not get graded on those questions, and you do not know what those questions are. So don't just treat every question like it's a real question, and that always frustrated me, not knowing that, but they have to change it constantly and keep it up to date. So when you get an email from the licensing board or the ICNRC and the licensing board confirming your scores, which sometimes takes forever, and you might have to reach out to somebody at the licensing board. I actually reach out to like the head guy, but he probably doesn't like that. You get your email, you got to pay an application fee. This is for your actual licensure. This is not for your exam. This is for your licensure. It ends up being, in Maine, about 61 bucks. It's like a $21 background fee and I think a $40 application fee. You do it right here. It's on that same page of the professional licensing. Apply for a license, boom. And then if you have a criminal history, you're going to have to take some additional steps for your licensure to be approved. And that's, in this field, we see that a lot. That's okay. That's not going to stop you from getting a job in this field. That's not going to stop you from getting credentialed in this field. But it is going to be a little harder for you than somebody that has no criminal history at all. But it's really pretty easy. You just got to put in a little legwork. So what if I have a criminal background? Well, you want to go to the courts in any towns that you've gotten any criminal charges, and request your criminal history. They're going to charge you a fee for the papers. It's okay, just get them. You don't want to get rid of these once you get these. Once you get these records, keep them, because when you apply for your LADC and so on and so forth, or your CCS in the future, you're going to need them all over again, regardless if you've already submitted them. Write a detailed letter. They're going to ask you to do this anyways, so you might as well do it ahead of time if you can. To the licensing board, explaining why you received each charge. They want to know for each charge, and some of these dockets can be long, why did I get this charge? If you were in active addiction when you got your charges, be honest about that. Say, I was in active addiction, I wasn't living a good life, I was making poor choices, and then describe what you've done since then to rehabilitate yourself, right? Because a lot of people that come into this field do have their own history of addiction, and that's completely fine, and the board is very forgiving of that. They're not going to say, oh, they were in active addiction, they shouldn't work in this field. In fact, I think they place some value on it to some degree. So just be honest. Say, I was in active addiction. In my letter, I had to write at times, I don't even remember getting this charge. I was in active addiction. Just be honest. That's the most important thing. So describe what you've done to, rehabilitate yourself. And then if you feel like your criminal history is like really severe, and sometimes they have you go in front of the actual licensing board for a hearing. It can be a little intimidating where they, make a decision and they all get together and talk, and you might want to consider including some letters of recommendation just as an added thing. Like, you don't need them, but it is helpful for people to say, like Robin, maybe if she knows you and she's worked with you, hey, this person has been like a good student. They've been, or maybe one of your instructors or somebody that can speak to your character. It's good to have them in your back pocket. It's rare that they do call a hearing, but I've seen it happen. I'll just say that. Now, once you get that and you apply for your CADC, and so you pay the fee, if you have a criminal background check, you give them all that stuff. The board's a little slow and laggy. They're very short-staffed. Sometimes you got to follow up with them. That's okay to do that. Don't feel bad doing that. Give them a little time, though, because you don't want to anger them. You don't make them take longer. For me, in my case, I had already had a job offer, so somebody where I was starting my job advocated with the board for me and said, hey, we are just waiting for her credentials to go through so we can hire her, and so on and so forth, and it was helpful. I hire CADCs and new people coming into the field often at the place that I work now. So I wanted to try to share some things that I look for when people are interviewing for jobs and some things that I think might be helpful for you guys. Be your authentic self is the most important thing. I have seen people come in like so stiff and stressed out and anxious, and I don't get to see who they are as a person, and they think like they have to be this really rigid. No, this is a counseling field. Being authentic is part of what we do, and we're gonna have to be authenticity, right? I wrote that right there, is a big part of working with clients as well. They can see right through any front or anything we put up, and so can somebody interviewing you for this position. So just be you. It's okay if you don't know all the answers. You're brand new in the field. There's a lot of places. I have hired multiple brand new clinicians. I was a brand new clinician, and now I'm the clinical supervisor of where I work now. So it's okay if you don't have all the answers. Say, I don't have the answer to that. I'm looking forward to learning. I'm hoping I can have a supervisor that will support me in learning these things. Definitely tell the truth if you have any criminal charges, even if they don't ask you, okay? Because what happens where I hire people sometimes is that if somebody has a criminal history, if it's certain charges, I can sign a waiver and say, I agree that I feel like they have rehabilitated enough to be okay in this role under my discretion, and they have disclosed to me. It has to be checked that it was disclosed in the interview. So if they don't ask you, say, hey, I just want to be transparent with you guys. I do have a criminal history. This is kind of what it looks like. And then that way, if they can do the disclosure thing, you're all set, you disclosed it, and they can push it through. And a lot of addiction counseling places hire people with criminal histories, with significant criminal histories. So don't be afraid to be honest about that. I know it feels like shameful and stuff, but we're all here for a reason, and we're going to be working with people that also have these types of experiences. So yeah, just try to be open and honest about that. Have at least a basic understanding of addiction counseling theories, especially CBT and motivational interviewing. Motivational interviewing is more of like a skill set, but this is what you're going to see early on working in addiction counseling. We can't use certain mental health interventions, right, or theories. So CBT is very common in addiction treatment. Understand the bones, at least, of how it works, which is pretty basic when you break it down. And motivational interviewing, we do a lot of that to get people through the stages of change. It's really important. I remember being in motivational interviewing class, and we had to do like fake little role playing, or I don't know, but I hated it. This is a skill you will work on mastering for years. I mean, it's not something that's going to happen overnight, and it's certainly not something you're expected to know right away, but understand what they are, because we do use these a lot in the field. And they might ask questions also about the stages of change or the trans-theoretical model, whichever way you've learned it. That was asked to me in my initial interview, so know that. Basic things, right? Try not to be too nervous. It's okay if you're new to the field. The good news is that there are always places hiring in this area and across the state and in other states, I'm sure, with the crisis we're facing with addiction right now, especially post-COVID. remember, like, you're there because you have something to offer. You have something to offer this agency and whoever you're interviewing for, so do not sell yourself short. Because just because you're brand new in the field, like I said, I was brand new and I run the program I work at now. I had no clue about anything. I didn't even know what I was doing there. And you've got to understand that you're there, you're offering yourself into this position, and that's not something to be taken lightly. Use language. This is kind of something that I look for when I'm interviewing people personally, because it's something we need to understand in the field of counseling, is to use language that is person first and client centered. Those are things that we in the field have to be cognizant of all the time. So we don't say somebody that's addicted to drugs. We never say that, right? That is not appropriate language in our field. You would say a person with a substance use disorder. So if you're talking to somebody that's interviewing you and you're using that language, the language that we speak, that I speak, that we all speak in the field, they're going to be like, oh, okay, they've got the language, right? And that can really push things a long way. Most just be yourself, be real. My favorite interviews with people have been just them being completely honest and raw with me, and they've turned out to be great employees. I really like this quote, and I like to add quotes to every single PowerPoint I do, so excuse me for that. But understanding why people suffer, how they change, and how to help them live more satisfying and gratifying lives is a fascinating, huge, and important undertaking. So the field that we are in as addiction counselors, it's huge. And I was talking to Robin a little before this, but I think a thing that people are seeing, or that's being seen, is that a lot of people aren't going on to sit for their CADC after they do all their schooling. I am here to tell you, sit for your exam. You have paid a bunch of money to get this degree. Sit for your exam, get your CADC, get your foot in the door. Even if you're doing non-clinical work, or you're like a res tech at like a residential program or something like that. I have 2 CADCs that aren't even counselors that work for me. It's good to get your licensure. It's good to see the fruits of your labor of being in school, and opportunities could arise, and if you haven't sat for your exam and done that, you could miss out on like a really good paying job, or because I'm getting emails every day about jobs. I'm like, geez, I should leave my job. No, not really, whoever's watching this. I would never do that. But no, for real, sit for your exam. I know that it's scary. The worst thing that's going to happen is that if for some reason you fail, right, which I think I've seen happen one time ever to somebody that has been a graduate of this school. You fail, you got to wait 3 months to take it again. That's it. It's not like that you're never allowed to be a counselor or anything like that, but really, this school does prepare you to know what you need to know to pass your exam. And I had to do fairly minimal studying to actually pass my exam. I wouldn't recommend studying for like months and then taking your exam. I would try to give yourself a couple weeks before your exam to study and not wait too long before graduating and scheduling your exam. Because that's something I wish I had done differently. I waited, I think, I was still in school, but I could have already sat for my exam for like a year before I sat for it. And that was something that held me back, because then I had to wait forever for the licensing board to push my licensure through. And I had to take a pay cut before I could get a pay raise. So sit for the exam. If you fail, it's not a failure. You can do it again. Some people get test anxiety. That's okay. That's why being online in classes is really helpful, because you have to do the quizzes and stuff like that. Get used to that. A lot of those quizzes are preparing you to choose. This is another thing. On the exam, it's not the right answer, okay? There's sometimes more than one right answer. It's the best possible answer for the question. So you might be like, geez, a couple of these could be the answer. Just think to yourself, what is the best possible answer? And then do your best. At the end of the day, it's not life or death. I'd be more stressed out about sitting for my LADC, or I was more stressed out about sitting for my LADC than my CADC. My CADC was fairly easy. The L was more critical thinking and just conceptualizing and things like that. So I'm going to open the floor for any questions and answers. I'll give the answers, you give the question. Yes.
When can you sit, like I graduated soon, so when can you sit for it? Like, when should I apply for that?
As soon as you can get your transcripts, which they'll give to you right after you graduate, you can apply to sit for your CADC. Yep. So I would get on it sooner rather than later.
Because you said you were still in school, so like as soon as I finished that last class?
I was still in school because I chose to do my program where I did my diploma first, and then I did my associates right after, and then I did my bachelor's. So I've actually graduated 3 times, but I only have a bachelor's degree currently, and I'm in school again. So I was in school for my associates, but I could have gotten it with the credits I had from my diploma already. I just chose not to. Yeah. So I would, as soon as you can, because the closer you are to learning the material, the more you're going to remember what you've learned, you know.
My brother's going to give me that book like the 1st of December. So
Yeah, that's not too far off. That's perfect.
and I've ordered a bunch of extra books like on the topics. So.
Don't get too book crazy on.
I like books.
But if you like reading, absolutely, it's going to serve you well. I mean, being in class,
And CBT therapy I do myself anyway, like workbooks.
I
I love
definitely do my own CBT as well. It's been helpful in my life. So then you understand, like, CBT is just basically like
retraining
the
your-
thoughts
Yeah.
that we have can trigger the emotions that we experience, which can trigger our behavioral response to things. And sometimes our thinking comes from distorted core beliefs or core beliefs that came from traumatic childhood. So sometimes we have to retrain ourselves to understand that our thoughts might be causing our feelings, not necessarily the actual situation, right? Because we are looking at the situation through a biased lens. So and we all have our own different core beliefs, and that's what makes it so complex. Yes, Stephanie, I do have a reference page, just so you know, because I would never, ever not do that, because this is ethical. Also know this, like, the further you go on in your career, and like I have to do a lot of presentations and things like that at different summits, and you always include references, not just when you're in school. Anything you do that you reference anybody else's material, we'll put a references page, please. Question?
Some questions on Facebook.
Great. Hit me with them.
First one is, how long did it take you to get you where you are now?
Okay, so great. That's a great question. Actually, not that long, believe it or not. So I have been where I am currently for 4 years. I came in at an entry-level position. I hadn't even been credentialed yet, and I worked there for 3 years before I was promoted to the leadership position that I'm in now. So it really only took me 3 years to get to the position I am in now. Yep.
And the other one is, how long did it take you to get your CADC after you tested?
Oh, I feel bad answering this question. So my circumstances were that I did have a criminal history. And in that situation, because you do have to send the letter and it's a big ordeal, and then they have to kind of commiserate together about it or whatever they do at the board, it took me a while. I think it took me probably about 3 months. Luckily, I already had a job offer where they let me enter at a different position that wasn't a counseling position because it was at a residential facility. And then they kind of fought for that. But I have also seen people get it very quickly if you don't have that. I've seen one of my employees get hers in probably expect at least a month is what I would say. Because the board, my supervisor that oversees all of our programs, she is on the licensing board. She works for the licensing board, and she said they have a very small staff right now. And so one of my clinicians just sat for L. It took about a month. So I would expect at least a month without any complications. And if you do have a more complex past, understand that it might take a little bit longer. Great. Anything else?
Well, just to add to that, one of the things that was mentioned is getting your CADC while you're in school.
Mm-hmm.
That is definitely possible. So once you complete your diploma,
Yeah.
even if you're going on to the associates or if you're somewhere in between, go ahead and sit for the exam.
Get it.
Get it done. That'll help you as you're getting out and getting more experience in the field to build up for your overall career once you finish. So this isn't something that
Absolutely.
you have to wait for, saying, oh, I'm going to go ahead and get my bachelor's. Go ahead and get this too, because then you can be working in the field while you're doing the studying.
That's a good, really valid point, Phil. For the entirety of my schooling, aside from my diploma, essentially, I have worked in the field at full time while being in school to get further education and further credentialing. In fact, I am again in a master's program now and running a residential treatment program. So you don't have, if you have the 30 credit hours to get it, you can even request your transcript for the credit hours you have. They're going to look at the credit hours from classes, especially that are centered in the counseling field, right? So like you take enough of them in this program, I know, but also I know when you go further on, the diploma covers every credit hour you need to actually sit for your CADC. So know that you don't need to have your associates even fully. You can actually send believe it or not, this is horrible, but an unofficial copy of your transcript. You can request from the school to see what classes you've taken so far, and if you've already met the requirement for the credit hours, send it over to the board and apply for your exam. Chances are you're going to be allowed to sit for it even if you haven't even finished your degree. Now, I would encourage you to finish your degree because when you are going into higher up positions within the field, people do look at educational background. The good thing about the state of Maine and your CADC is that you don't need to get a further education to get your LADC. You really essentially just have to work under an LADC for a year, and then you can apply for your LADC exam. But if you do want to be in like a management position or move your way up, it is helpful, not necessary, because I think a lot depends on your character, how hard of a worker you are, things like that, to have the bachelor's degree and some of them have minimum job requirements that you have to have a bachelor's degree, but that's not what you need to sit for your CADC, so don't worry about that. There's no fear in the CADC, guys. I swear it's actually a breeze. I thought it was very easy, and Gina, she's here, and she's not a current student, but she's bombing our show, but she's sat for it too, and she can probably attest to the fact she waited forever to take hers.
Sure did. Mm-hmm.
So
Yeah.
it's
Couple
easy.
years I waited.
It's easy, it's worth it. You're paying for this schooling, you're passionate about this work. People out there need our help. Like, this is important. This is important. This is sacred work that we're doing. And I think that, like, I can't express that enough, that the work that we do is sacred. The work that we do is life-saving. It's really the work our clients do, but the work that we do in collaboration with them, right? So if there's somebody that just has this great drive for this field that's not sitting for their exam and they're just scared or they're not pursuing this goal because of their own fears, like, there could be somebody out there that could benefit from your services or your support in their time of great need. And that's not to like put us on a pedestal, because it's more power with than power over, but understand that we are in this Penobscot County, especially with the overdose deaths and the lack of resources, we are really struggling to get people into counselor positions. I mean, we're hiring aides at some locations right now, which is just, you don't even need to have schooling for. You just need a supervisor that's willing to supervise you. So you'll get a job if you get your credentials. That's for certain. Just do it. Take the risk. You're gonna be fine. If you came to Beal, you're gonna be fine. That's my motto.
Do you know anything about accommodations for people who have learning disabilities or anything like that with the exam?
So I did print some of these because that goes deeper into that, and I'd advise you guys to take them, and we can email them to anybody that's on Facebook that wants one, which is the candidate guides for the ICNRC exam, and that goes into more the accommodations and things like that. I personally didn't have to deal with the accommodations piece, but I do know that they do allow accommodations for people that need accommodations for testing. I think I just heard that they have like one person that works with it, so it can be a little challenging, but I would grab one of these candidate guides, because this is going to tell you all that in-depth stuff about what accommodations can you get, what steps do you need to take to get those accommodations, and request them if you need them. Some people struggle with like different things like reading, or usually by the time you've been through school, well, some people have severe crippling anxiety, honestly. And it is a lot. I was blessed because Beal used to be a proxy site. They are no longer, unfortunately. So this was where I was comfortable taking classes, so this is where I sat for my exams. So I got to have Steve lurking over me for the duration of those, which I'm not sure if that was a hindrance or a help, but it was a comfort zone for me. But know that you're going to be going into a building that's most likely not going to be your comfort zone. So, you know, they say like try not to cram right before the test. There's a lot of things because your brain retains stuff when it can digest it more. So don't like get yourself all jacked up on coffee, things like that. We all need a little caffeine, but we don't want to be like, because you're already going to be shaky. You're going to open up the exam. You're going to see a whirlwind of questions and you're going to think, crap, I don't know this material. And you do. I thought it when I opened it, and I got a really great score on my exam, and I was convinced I failed. No, you are second guessing yourself. You have got this in the bag. You know this information. Trust your gut. Don't change answers and keep it going. Because right now, like, yeah, the hiring pool, I'm sure Phil knows, is there's tons of people hiring. And you can do anything. You can do outpatient counseling, IOP, you can do residential like I do, you can do the clinics, like if you want to work at a methadone clinic or something like that, which is more like brief intervention type stuff. But there is always people hiring and they can't keep these positions filled. So if you're not sitting for your exam, you could be missing out on a good opportunity. I got an email today, every day.
Do you work while you're waiting to get certified?
So I did because I was in a non-clinical position. So a lot of residential programs have positions that are like non-clinical. So you kind of watch the house when the clinical staff isn't there, the rehabs. And so they let me in a non-clinical position because they knew I had passed my exam. I was waiting for the certification to go through. Or even, we hire people sometimes that we just know are Beal students in a non-clinical position. And then when they can sit for their exam, we support them in doing that. And then we try to bump them into a clinical position because we have a whole agency of different locations. So there are jobs that are substance use disorder related that you can work without being credentialed.
Is that the tech you were talking about when we were talking the tech
Yeah.
positions? Yeah.
That's like I actually am hiring one right now, but it's only 16 hours a week. Just putting that out there for anybody that is looking for a.
That's not enough hours for me.
I get that. That's the problem here. You know, so yeah, you can enter at an entry-level position like that and then wait to get credentialed. And then usually if you're an asset to the agency, I know my agency has built me up to be where I am today, and I'm just moving on one of my clinicians to a leadership position. She started out as an aide. She started out as the parent coach, actually, as crazy as that sounds, and then was an aide, and then sat for her CADC with the degree she had, which was in lifespan development or something, or human development, something like that. It wasn't even something I thought you could sit with, but she did. She passed it with flying colors, and now she's LADC CCS, and she just took a leadership position at our detox. So we're always hiring because people are always moving up into higher positions.
And your program's great, like I said.
Yeah,
Brother.
I love working there, but it is sure hard some days.
We have another.
Yeah, there's one more.
Oh, great.
They asked, what did you say the score range was and about how many questions?
So there's 150 questions, and the way the scoring is, it's between 200 and 800, and it's not like a traditional scoring, but you have to have over a 500 to pass. So really, if you look at it in the context of, if the highest I can get is 800 and all I need is a 500 to pass, that's 300 points that I can lose somewhere in there if I have to. 150 questions sounds like a lot. 3 hours is more time than you think, especially once you get bookmarking the questions. That's why I say don't get stuck on a question, because you're going to burn up all your time. And it could be a question that, for all you know, is one of the test questions that you're stressing yourself out over, and maybe it's harder than it should be for that exam. So yeah, 150 questions, 3 hours, and the score you got to get above a 500. So highest you can get is 800, but I've never seen anybody get, I think the closest I've seen people get is like 713 or something. Yeah, which was pretty good if you think about a test with that many questions that you can't have any books to look at while you're taking. Is that it?
Any other questions?
Facebook.
Great. Awesome. Well, I appreciate everybody that's attended this, and if you're watching it on a recording, I hope that this helps in some way, shape, or form. Phil knows how to contact me if there's any additional questions that come up. I'm always willing to connect with students in undergrad programs to help walk them through this process as best as I can. Again, I work full-time, I'm a full-time student as well, so I will do my best to do justice by you in getting you answers, and hopefully this helps some people out there, and I hope everybody has a good evening.